All right, good morning, good morning, good morning. Today is day 2 of our med aid training, and this is the adult care home med aid training. Like I said yesterday, we had 2 types of the med aid training. We have the one that is for the skilled nursing facilities, and then we have the one that is for the adult care homes. So this training is the 15-hour med aid training for those working in the adult care home that want to be able to pass medications. Now there are some skills that as a med aid working in an assisted living or a family care home, a group home, independent living, you'll be able to do that. A med aid working in a skilled nursing facility is not permitted to do. So one of them we identified was insulin. So when we meet for the skills, we're gonna go over all those, how to check blood glucose level, and then how to give insulin. We're gonna do all that. So injections, some type of sub-Q injections can be given by the med aid working in the adult care home, but the one in the skilled nursing home, because they have the LPNs and the RNs in the unit that are overseeing all those things, they are not permitted to do so. All right, so today we want to complete our sections. We got to the infection control. We're going to finish that. Like I said, there's a full course that the state, the DHSR, has provided as a curriculum that, as an instructor or as an educator, I'm able to teach that infection control course. So I'm going to give you all access to that course, maybe a week or two later when my schedule has been freed up. So you have deep knowledge of infection control, because adult care home setting, skilled nursing home, all these places in the hospitals, infection control plays a major role. We need to be able to bring the chain and the cycle of germs and infection. So it's one of the most vital classes or training that every caregiver must take. So let me share my slides, and then after these slides, we're gonna watch all the videos that the state gave us. It demonstrates how to do medication administration in all the routes that we have spoken about so far, or we are about to get into all those routes right now. So right after we see and teach all those, then we see it in video, in action, how that works. So that will give you the clear idea and picture how you're gonna do your skills demonstration when we meet in the skills lab. All right, so I'm sharing my entire screen. I'm going to go to share. Someone can let me know in the, or mute your mic and tell me if
Yes,
you
sir.
can see my screen.
Yes, ma'am.
Okay, thank you. All right. So, like we did yesterday, I'm going to go through all the other topics that is left. If you have a question, just write it down. When I take a pause, you can bring up your question. We'll discuss it and get everybody to understand, and then we'll move forward. So let me minimize this, get this out of our way. All right. So yesterday we got to infection control, which is section G. All right. So after this section, every student here, we need you to understand the importance of hand hygiene. You should be able to demonstrate hand washing techniques, how to use the alcohol-based hand rub technique, which we will do all that in the skill lab. The proper way of putting those alcohol-based rub, you'll be able to understand what standard precautions means and what it means when you are monitoring glucose and giving injections, glucose injection, which is the insulin. So the handout gives some images about how to go about all that. So take time and read through your handouts and everything, understand what you're supposed to do, practice it at home. If you can, if you have the time, learn how to put on your gloves and remove the gloves the proper way. All right. So I'm going to ask each and every one of you, when we say standard precautions, let's start with Lady Tina. How do you understand standard precautions? What is it?
The normal, the the main things that you use to keep from things passing from one to the other, like gloves, gargles. I mean, not gargles. The eyewear, the mask, the hand washing, the um, a lot of different ones of them that goes. It's everything you use.
Okay. Thank you very much. Yes, Lady Jamie, how do you understand standard precautions?
How do I understand standard
What do you know
precautions?
about standard precaution?
I don't think I understand the question.
What do you know about standard precaution?
Oh, God.
Have you heard the word standard precaution? What do you know about it?
I'm sorry, I'm drawing a blank. I'm not really,
I believe your PCA course also touched on it a little bit,
mm,
on what standard
uh,
precautions was.
okay. Um, you know what?
Yeah.
Hold on. I've got to get my notes. I apologize. I'm sorry.
It's okay. So just as Lady Tina said, you know,
Go ahead, Tina.
yes, just what Lady Tina said. You need to understand those are the information. Um, so use when you want to do medication administration, important infection control concept you need to understand. You need to use sanitary technique when pouring and preparing medication into the appropriate container. One thing you need to understand, you do not touch or handle medication with your bare hands. Don't do that. You have to pour medication from the original medication container into a new medication container, the appropriate one you are going to use to give out that medicine. Never use your bare hands to administer medications, and never require the resident to use their own hands to receive the medication. Leave it in the medicine cup. Hey, Miss Joey, good morning. I got your medicines here. You verify who they are, and then if it's Tylenol, you put it in the medicine cup. Tylenol may be inside a bottle or in a drug card. You always wash your hands, you put on your hand gloves, and then either you are popping it out from the drug card, or whilst it's inside that big bottle, you just use it. And either you use spoon if it's a big bottle, or you just let it come into the medicine cup and you hand the whole medicine cup to the resident or your patient. Don't tell them, open your arms, stretch your hands and get it. No, you don't know whether their hands are dirty. Sometimes a very confused patient or resident may be digging, excuse me to say, in a poop that they are sitting in that you may not be aware of. So their hands got doo doo. Their hands got doo doo on it. Okay. Sometimes they may have it inside their groin area, scratching, 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 because they are itching down there somehow. You don't know. And then you go, you tell them, stretch your hands for your Tylenol. Don't do that. This is all part of infection control. We want to break the chain of what? Infection. So hand them the medicine cup. Don't tell them to bring their bare hands for what? For that medicine. Medications are provided to the resident in clean and appropriate medication containers or the cups. So when we say standard precautions, we want all med aids, all caregivers that give medication to observe standard precautions. You wear your gloves when there may be exposure to bodily fluids and mucus, such as the vagina, the rectum, inside the nose, and their eyes. Cleanse hands frequently with soap and water, with alcohol-based hand rub. Your hands should be washed with soap and water when it is visibly soiled or if there has been a contact with bodily fluids before eating and after using the restroom. So when you come out from the restroom, you don't quickly come and stand by the med card and start passing medicines. You wash your hands. If there's no soap, you use the alcohol hand sanitizer. So wash hands before and after the removal of your gloves. It's very common. It's very easy to think that, oh, I just use the gloves. I don't need to wash my hands. Yes, you need to wash your hands. Wash hands before and after using the shared medical equipment. What are some of the shared medical equipment? In a nursing home and in an adult care home, what do you think can be an equipment that you can use it on all your residents? Miss Tina,
A
what are
lift thing,
a what?
a lift
A
thing,
lift.
lifter.
Yes. What else?
Um, let's see, the handrails aren't really equipment.
Miss Jamie, can you think of anything that is shared, in these facilities? She said lift, which is true. We use it on all the residents. Yeah, they don't have individual lift for every patient or every resident. It's just one device that everybody who needs to be lifted they use it on them. What else is
The
a shared
belt,
device?
the belt
What?
that the belt that goes around the waist,
The gate belt?
gate
Are you
belt.
talking about gate belt?
You
Yes,
just
ma'am.
took my answer,
Yes,
Jamie.
gate belt. Mama Jamie said you just took her answer. Okay. Okay. That reminds me when we used to go to school. We had some student. I would tell you, you just took my answer. They'll tell the teacher, "Oh, that one just said what I was going to say."
No, really, again, I get confused with my microphone that's over to my right, and then the one that's with Zoom to mute. So I'm looking over here to the right, and then just as I found it, Tina says, the belt. You took my answer.
Okay, so one of the things that is also shared, the most common one is the ones we use for the vital signs, right? The blood pressure cuff, right?
Yes,
Yep.
Did
yes,
anybody think of
yes,
that? The blood pressure cuff, right? You use it
yes,
on
They're so
patient A.
commonly used, I didn't even think about it.
Yes,
right.
that's what I was expecting. That was the number one thing I was expecting everybody to say. Quiet. The blood pressure cuff is um the number one device because
Yeah.
everybody gets their vital signs taken, right?
Mhm.
Except the ones that may refuse that morning or during that shift, right? Yeah. So you are putting the blood pressure cuff on them. You are using either if they are using the same what do we call it? You go to the room, you use the thermometer, you know.
Right.
So
So,
if the pulse or oximeter, you put it on one person, you go to the next room, you use it on that person. So, what is the best way to break the chain of infection? What do you think should be done? Yes, Miss Tina.
Hand washing and sanitizing.
Using the equipment among the resident. What do you think should be done? What do you think is the best practice? When you are done with Miss Joey, you have to go to Mr.
Oh,
Jones.
always clean afterwards.
Yes.
before the next resident and after.
Yes, before the next resident. So cleanse hands frequently with soap and water. Thank you all for your answers. Wash your hands when it's visibly soiled. Wash your hands after you remove your gloves. Wash hands before and after using a shared medical equipment. Gloves should be worn, and hand hygiene must be performed when you are going to put transdermal products on your resident. What are transdermal products? Pain patch is a transdermal product. Pain patch. Transdermal. Dermal means skin. So on the top of the skin, you put a patch, a pain patch. Or you have a resident that smokes and they cannot smoke in the facility. So the doctors prescribe nicotine patch. So a nicotine patch is a transdermal patch you put on your. So we have something we call nitroglycerin patch. We have nitroglycerin. Nitroglycerin is used for chest pains and all that. So any duragesic patches, meaning pain patches, the thing that happens is that when you touch it with your bare hands, the potency of the medication is at the surface of that patch. It gets to you instead of getting to your patient, because you touch it with your bare hands. You receive the medicine, they don't. So the best thing is that put on gloves so that your bare hands doesn't get their medicine that's supposed to go to them. It will not be fair to them that you have received their pain medicine instead of they getting their pain medicine. So put on hand gloves so it doesn't come to you. So it will go to them. All right. So when we are using something like the pulse oximeter from Mr. Joey to Miss John Doe, you need to use the alcohol pad, that square thing that has alcohol saturated in it, alcohol pad. Okay, we use it. Use a bunch of them to clean around the pulse oximeter, clean around the thermometer, clean around the blood pressure cuff before you go and put it around another person's arm. To do that, we break the chain of infection when we do that. So let's talk about syringes, needles, and vials. Cleanse the top of medication vials with the 70% alcohol before inserting the needle into the vial. So you will see the bottle that I'm talking about. That when it has the insulin inside it, you have to clean the top of it first with the alcohol prep before you put your needle to squeeze out the medicine. You measure how many, maybe five. You are going to give five, or you're going to give 10 units of the insulin. Always clean the top first before you squeeze it out. That's what this is talking about. Never administer medication from the same syringe to multiple patients, even if the needle is changed. Don't do that. Do not reuse a syringe to enter a medication vial or solution. Say you squeeze it, you gave him 5 minutes, then you're gonna use it for a different medicine and squeeze something, and no, don't do that. Do not administer medication from single dose or single use vials, ampoules, bags, or bottles to more than one resident. We want to break the chain of infection, so don't do that. Don't say, oh, they look the same. They look the same. They look the same. So, oh, they are in the same room, so they can share. No, no, don't do that. Okay. It says, do not administer medication. Like I said, don't do that. Multi-dose vials should be used for a single resident when possible. So there's one person, whatever it is that needs to go to him, just one person. Don't transfer it to another person. Dispose of used syringes and needles at the point of use in sharp containers. So every facility has sharp containers. It doesn't matter the color. They will tell you during orientation, these are the sharp containers. It should be a leak proof, puncture resistance, and it's closed up tight. Don't put any needles whatsoever, syringes whatsoever, into a regular trash can. It is dangerous for whoever will go and remove that trash can later to go and put it in the dumpster. It can puncture them, it can do a whole lot to them. And never recap, bend, or break a needle. We used to do that back in the days. We used to do recap of needles until the CDC, the top people brought out this evidence-based rules that we should never recap, bend, or break needles. So let's look at alcohol-based rub. So you need to know where they are located. In the hospitals, all the halls, every few intervals, there's an alcohol-based the hand sanitizer hanging. Small facilities may not have that leisure to be putting hand sanitizers on the walls. However, they will have it at a designated areas. So you need to know where all your hand sanitizers are and where to use them. So when you look at the handout, if you ever had the time to look at the handout, you would see how it demonstrates how to put it, how you rub it palm to palm to you interlace your fingers, go through it, and then be able to rub it everywhere, because you are not using soap and water at that moment. They want you to do a proper rubbing of that hand sanitizer. So look, when you have time, look over the handout and see all the images of how it is done. And then I think one of the videos that we're gonna watch too, they also demonstrate that. So let's learn the proper way. We all have used it before, but now we're gonna learn the best practice for us whilst we go about our duties as a caregiver. So other important things that as a caregiver we have to be aware of so we can break the chain of infection. Our fingernails must be kept short at all times and clean. Short and clean. Now we know that the youngsters that we have in our time and age, the caregivers, they keep a long looking, claw looking nails, and they bring it to the workplace. No matter what they were taught in school, they still would do. But as a nurse educator, that is really a fanatic of infection control. I'll keep saying it in all my lectures. Keep your nails short whenever possible. Keep your nails short. Okay, let's leave all the fake nails to all the parties and all the other functions. And when we are coming to work, let's remove the fake nails, the extensions, the jewelries, and all those things. Let's keep them at home. Jewelries and all those things around our brain, what do we call this? The wrist and everything. It can harbor germs, because at work you are using gloves many times till your shift is over. Maybe it's an 8-hour shift, maybe it's a 12-hour shift. Many times. Keep all the. I mean, the workplace is not a fashion place where everybody's going to look at how pretty and how amazing you are in your jewelries and all those nails and all those things. It's a workplace, for crying out loud. We came there to take care of those residents. So let's come and do that, and leave all the other fashion things for our parties, and other enjoyment that we do at home. So gloves. This is the number one PPE, personal protective equipment, PPE, that can help break the chain of infection beside you doing hand washing. Gloves is very important. We have the non-sterile gloves, and then we have the sterile gloves. Most time our work will be using the non-sterile. Make sure you understand, you know your size, whether you wear small, medium, large, or extra large. Be sure to wear the one that fits you well. Because if you wear the one that is too big, in the middle of doing personal care, direct care, it can come off. And if you are touching bowel movement and your gloves is coming out, imagine that. So put the one that fits you well. And if you are going to touch anything blood any of that. I strongly recommend double glove. Why? Because the glove that are coming out lately, they are really thin and it tears very easily. That's my personal recommendation. It's all up to you whether you want to do that, or I've seen it break multiple times, tear multiple times. So I've learned the hard way. I don't want to touch anybody's blood. I have little ones at home. I'm not bringing any infection to my children. I will not do that. So I keep myself safe. I put double gloves. Okay. So when you are touching, you see the most place that is everybody touches. Guess one of them, the doorknob, right? When you're going to a resident room and the door is locked, what is the first thing you touch? The doorknob. Is one of the most common place you can grab or get infected. So I always recommend to my caregivers, I will tell you, immediately you get to work, you put your bag, your food, everything down, you wash your hands, you receive report. Once you receive report, the next thing you should be doing is catching wiping. I grab my alcohol, the clothes wipes that the workplace has provided for us. I put my gloves and I start wiping all my med cut. I will wipe down from top to bottom. Everything I know I'm going to touch, I wipe from top to bottom, even the wheels. I work at the hospital. Even the wheels of the car that we use, I wipe them. I wipe my chair down, top to bottom. The doorknob. So you who are going, those working in the small units, family care homes, make sure that all the resident doorknobs, you wipe them in the outside one and the inside one on your shift. It won't take but few minutes to do that. Trust me, you will break the chain of infection when you do that. You break the chain of infection when you do that. So you have to change your gloves right away if it looks dirty or torn. Take gloves off carefully and do not touch your skin. Don't touch your face with it. You know, don't do any of that. Do not touch anything with the dirty gloves that anyone may touch without the gloves, like I said, the doorknob. So when you are done changing someone did bowel movement, they peed, you use gloves, you change them. Then immediately you go and touch with your gloved hand, you go and touch the doorknob to open it. Don't do that. Remove your gloves first before you touch the doorknob. Because another person may come and touch that doorknob without thinking that it has some germs on it. So don't use your dirty hand, the dirty gloves to go and touch any other thing. Remove that gloves immediately before starting to touch any other thing. So always make sure that your gloves are comfortable, not too loose and not too what? Not too tight on you. So when do you want to wear your gloves? Wear it. I promise you, me, when I go to work, anything about my patient, whether I'm going to put on their clothes, even if there's no liquid fluid involved, I'll still wear my gloves, because I have learned over the past 21 years working in the healthcare field, that even in the middle of putting just clothes on the person might start coughing and speeding up. Anything can happen in the middle of doing something that doesn't involve any fluids. And if I have my gloves on, you know, I'm able to grab a tissue, give it to them, or help them if, they are not able to do that themselves. Especially if somebody's in bed and they are total care. You think, oh, I'm not touching any poop right now. I'm just going to put a dress, a clothes on them. And then they start spitting out something. you know. So if you have your gloves on, all you do is just grab whatever tissue and then wipe them off. You're already prepared. So I'm always gloved up. The only time I'm not having my gloves on is when I am done with every direct care and I'm sitting down, I'm not doing anything, then my gloves are off. If not, I am always gloved on. So it's all up to you. But we have to break the chain of infection. Always remember that. All right. Should be comfortable. Yes. So when to wait is what I said. Whenever you're going to touch anything bloody, body fluid, urine, stool, spit, mucus that is coughed up, Wear your gloves anytime you think you come in contact with a non-intact skin. The resident may have some skin tears, some sores, some cut. You need to wear your gloves so you are not touching any of their wounds and taking any germs home. When you're gonna be giving them medication in where it touches their mucous membrane, where their rectum, their mouth, their nose, their eye, especially the eye. You know, if you don't know what is happening, even if you receive report but you don't know, sometimes residents, they fall sick. You don't know what is going on until the doctor comes in and diagnose what is going on. You don't know. So if they have any eye infection going on that morning that you came to work, they have eye drops, and you use your bare hands, and accidentally you are touching the eye and everything. It's not good. You're gonna get infected, because some of these eye infections are infectious. So you always want to put your gloves on, even when you're doing your eye drops. Nose spray, ear whatever, mouth something, inhaler. Put on your gloves. Simple. When you might touch body stuff, non-intact skin, these are examples of why you have to wear your gloves. Providing assistance with mouth care. The nose is draining. They are having some sneezes. Their nose is draining. So wiping down the drain, perineal care, their borders, their genitals. They have cuts, they have sores. When you have to prick them to get their blood sugar checked, touching surfaces that other things could have touched. If they have open sores and everything, if other staff have open sores and everything, you need to wear gloves around them. So you wear we will one of the number one skill that everybody is going to do. That one is not part of the main skill. How to put on gloves, how to take off gloves. So donning on gloves and doffing off gloves. So we will do all that. I think those who took the PCA classes, we've already gone through that. We've already gone through that. And if you haven't done that, then when we meet in the skill lab, we will go through that quickly, and everybody should be able to do that as part of their main skills that they are going to do. So how to remove gloves as well is this one of the basic skills that you need to learn or know how to do. All right. So let's look at the supplies, medication supplies. So when you come to work, you are about to start your job. You're about to start. You should be familiarized with all the equipment that you are about to use to start. Your med cart, where you see your water pitcher, medicine cups, the cups that they're gonna drink from, alcohol preps. You need to have everything guarded. When you're about to administer medication, you must gather all your equipment. Okay, don't start giving medication before you go and look for hand sanitizer, before you go and look for alcohol prep, before you see that, oh, there's no insulin syringes. After you take report, after you've wiped down everything, you put on your gloves, go through from top to bottom of your med card, what is missing. Sometimes the one you are relieving, maybe their shift was too busy, they weren't able to refill the water pitcher. Go ahead and get fresh water. Don't use that water, that same water that has been sitting in that water jar for the whole 8-hour shift or 12-hour shift, and start using it to pass medication. Please give your residents some fresh water. It won't harm you. It won't take anything from your life to go and get fresh water for them. Don't use the same hot. It might be even hot. Give them some fresh water. Get your juice, orange juice, apple juice, pudding, chocolate vanilla pudding. Because as you begin to work, you will learn that some of your residents, they can't swallow their pills whole. You have to crush them. You have to put them in apple sauce. You have to put them in pudding. Get all those supplies ready. Get all those supplies what? Ready. So after washing your hands, putting on your gloves. Get all those things ready. Your band-aids have to be there, your tape, your gauze, because you may have to do some treatment for maybe. Oh, they'll tell you after giving the medicine, can you check my arm? And it looks like I have a skin cut. So you report it to the nurse, you let them know that there was a skin cut, but you are equipped to be able to put some band-aid on it. As a medic, you can do that. So make sure you're pretty much make sure that all you have every supply available on your cart. Your alcohol wipes, your hand sanitizer, your box of gloves, the surgery lab is a lubrication tubes. Maybe one of your patient get a medication that is what it goes through the rectal or vaginal. You have to have all those ready. Your band aids. You look through the med card, everything has been arranged. So if the supply there is depleted, go get some from the med room. Your pill cutter, your pill crusher, your tissues, your tongue blade, your spoons, disposable cups, your straws. You want to make sure your shuffle cups, the metered medicine cups. Everything has to be what? Ready. Like I said, your water pitcher, fresh water in it. Okay, stock your cabinet and make sure everything is what? Ready and is safe to start your medication pass. And you want to make sure that your medicine room, whatever you took from your medicine room, you put on your med card, is locked. You have to lock it at all times. You have to keep the keys with you. Don't trust anybody with your med room and your med card keys. Even if it's your blood relative, don't do that. Your licenses depend on it. And like I always tell people, I work so hard to get my nursing license, and I won't lose it for any reason. I don't want to lose it for any reason, because the time that you use to plead your cause that you didn't take that medicine, you didn't do this or that, you would have been using it to make more money than being on administrative leave without pay. Try to defend yourself, defend your licenses. So go according to the facility policy regarding maintaining security of the medication. If you don't know about it, if you are in doubt, ask. Whenever you leave your work area, lock the medicine cart, lock your medicine room. Do not leave any medication unattended on top of your cart to go and do this or that. Always keep it safe and get it locked. Or almost all the medication card that I have worked around and worked with has a lock. All of them. So whenever there's something that is urgent and I've put the medicine, I put it back inside, I lock it before I go. No matter the emergency, don't leave medication unattended. Don't leave medication with your patient and say, oh, okay, you're about to give it, somebody's calling your name or screaming, help, help. And then you leave the medicine with the resident and don't do that. Take the medicine with you, lock it up. When you are done taking care of that emergency, come back and give the medicine. Take your time, because every resident deserves some time. So don't rush them and don't leave it with them. Go and take care of that emergency. Come back, take your time, and let that person have their emergency. Throw away trash according to the agency policy. Don't leave trash that you made on your shift for the next person to come and remove it. This was a big thing in the nursing home. CNAs will be fighting, nurses will be grumbling, like that person left, they didn't remove their trash. This is common sense. Why do you want to leave the trash you made for someone to come and throw it away? You know, whatever you would want them to do for you, you should do the same for them. Keep your area clean before you leave. I used to have one nurse, an elderly nurse. She retired and then came back to the workplace again. So she was a travel nurse. And by the time I get to work, she has removed the trash and then she will wipe down the whole cat. So I asked her, why are you wiping down the cat? I would have done that. She said, I know you are the one coming to relieve me, and I know how you wipe everything from top to bottom. So I want to keep it clean for you because I know you love to wipe down. I'm trying to make your job easy. And I'm like, oh, Mama, you don't have to do that. He said, well, I know how hygiene and all those things is important to you, so I'm trying to help you. And I'm like, okay. So and then one other nurse picked up the everybody in the building, like Rosalind will wipe from top to bottom when she pick up from you. So anytime I'm relieving somebody, I will come and see them. They are wiping. I'm like, why are you doing that? They said, oh, they said you like to wipe with the Clorox thing. So I was trying to wipe it before. I'm like, you don't have to do that because when you leave, I will still wipe. I'm a wiping freak. Yes. So I want to make sure everything is clean. I want to break the chain of infection. So it's very, very big. It's a big thing for me. All right. So we're going to talk about the administration of the medicines itself. So we have to use our six rights to minister the oral, the sublingual, the topical, the transdermal, eye, ear, inhalant, and nasal medications. So remember your right resident, right medication, right dose, right route, right time, and right documentation. Identify proper action to take when crashing or cutting medications in relation to what medication administration. It is very, very important. This is the core reason why you are taking this course. So, number one, let's look at oral medications and how you administer. Some residents take multiple oral medications at once. Okay, you put everything in one cup, you give it to them. Here you go, sir. They can put it in their mouth, take water, and at once they take it. Always ask your resident, how do you like to take your pills? Do you like one at a time or couple of them at a time? Do you prefer to take one few at a time? If they tell you, then you have to assist them. If they want to take one to two at a time, or they will tell you, I want to take the big one first. Can you break it in half? Do that for them. Remember to pour them 8 ounces of water for the resident to drink with medication. When all medications have been swallowed, encourage residents to keep drinking more of the water. So I always tell them when I go to a resident room, greet them, introduce myself, and then tell them what I'm bringing to them. When I bring it, I bring a full cup of water. And I said, water is good for you, right? I start to do that education with them. I said, water is good for you. Water will keep you hydrated so you don't become so dehydrated that you will be all confused. So I want you to drink all your water. So I give them the reason why they have to drink their water. You know, it encourages them. I do that all the time with my patients. When I work in the skilled nursing home, I tell my residents, I believe I know you may not have drank a lot today, so I want you to drink all your water. Water is good for you. Then they'll be like, "Yep, water is life." So give them a reason for them to be motivated enough to drink that water that you brought. And besides, when they are able to drink enough, it pushes it down to their stomach and is able to have the effect that they need. Give them a sip of water first. It helps them with easy swallowing of their pills. So we have the tablet, which we've already spoken about, hard compressed medication. Some are round, some are oval, some are square shaped. It comes in different colors. We have the enteric coating. We have those that are delay release. We have the capsules that may be hard, that may be soft. Those that dissolve quickly in the stomach. So let's learn about absorption rates. Absorption rate. When administering your oral medication, it is important to administer at the time that it was prescribed or scheduled, because oral medications are absorbed or they is used by the body at different rates depending on the factors. So some of the factors is the patient taking the medicine on empty stomach, or are they taking it with food? So if someone is taking something on an empty stomach, the absorption rate may be faster than someone who has eaten a full plate of something. Okay, so always understand that as a med aid who is being trained to give medicine, you have to know there's a little concept of how these medicines are working in the body. So remember, if it's an empty stomach, the rate of absorption or how the body takes whatever content in this medication is faster than someone who has a full belly. Always understand that fact. And your medicine will tell you take it before meal or take it after meal or take it with meal. So whilst they are eating the meal, they have to take it. All right. So we you need to understand cutting medication. Sometimes medications have to be cut in half to get the correct dose. This should be clear on your MAR, your MAR. So always make sure that your med cart has the pill cutter where you'll be able to divide it into equal half. If your pill get cut in uneven pieces, you have to throw it out and get another one. Now, what if it is an Ativan, which is a controlled substance, a narcotic drug, Ativan, and you don't cut it in equal, you need to get your supervisor immediately or whoever is the administrator because it is a narcotic drug and you must account for it. Narcotic drug, we count it. Two people have to count it. So you want to make sure somebody see what has happened. What if it fell down? You have to get an eyewitness. Let them know that the thing fell down. Always get a witness so that they will not think that you are a drug addict who is what taking the medication of the patient, because you will explain from heaven to earth. Nobody will believe you and your license will be taken away from you. Take this from me. I've read so many cases: CNAs, med aids, nurses, LPNs, RNs losing their licenses over this issue that we are discussing today. It's very important. So if it doesn't cut equally, and most medication that needs to be cut, they have the middle. The pharmacy make sure that they bring it in a size and have a middle, a line whereby you can put it by the pill cutter thing and cut it by the line. So be gentle when you're doing it to avoid all those drama from happening, and be gentle that you don't cut yourself in the process of that pill cutter and use it to cut yourself. So discuss with your supervisor if the pill needs to be halved and you are not getting it right, so you don't end up wasting too many of the pills because it costs them thousands of dollars. All right. So follow the facility policy about disposal of the other half. It is important. Don't throw the half away. Let the administrator know, what do I do with the other half. Let them teach you. Let them explain to you, especially if it's a narcotic drug, because in the med room there are disposable containers that we put narcotic drugs in all the facilities, and another nurse have to come and witness you put that half. So if it's a morphine, if it's a hydromorphone, if it's an oxycodone, if it's an Ativan, or any of these glucosamide, if it's any of these drugs, any of these narcotic drug, get an eyewitness, see you put the half inside that disposable container. If not, they will say that you have taken that half, you have taken it, and you can never defend yourself because you don't have an eyewitness. So follow the facility protocol and do the needful before they take your license away from you. So when we get to the skill lab, we will demonstrate how to cut a pill into half. It's part of the skills that we will learn when we get. So they have a list of do not crash medications. You can look them up online. Every facility will have a list of do not crash medications. And every resident's medication that doesn't need to be crashed, it will tell you do not crash this medication. Always make sure you are reading it correctly. Let's look at crushing medications. Medication may need to be crushed if no liquid form of a medication is available and the resident cannot swallow an oral solid medication. Your MAR should state if a medication can be crushed. MedAid will not make that decision. You will not make that decision that, oh, she can't swallow, I'm going to crush it. No, don't do that, please. Let the doctor know so that they will change the orders for you before you do so. Don't take matters into your hands and make that decision and do whatever. You'll be in trouble. Your license will be at stake. Don't do it. And there are several methods to crush it. So the mortar and pestle is long been done. They don't use it anymore. We have the pill crushes and it comes in different shapes. So we'll see some in the lab when we meet to do the skills. So you can crush it whilst it's in the package and then you open it a little bit and then you pour it into your medicine cup. Or you can bring it up and put it in a shuffle cup and then you crush it and then you put it in the medicine cup. After you are done crushing, make sure the pill crusher that you use the alcohol prep, clean it and put it back. Or you can use water and soap and clean it, wipe it clean and put it back in the storage for another person to use. Don't leave the medicine residue inside the pill crusher so that when another person comes and uses for a different resident, that medicine, that old medicine still have something in there and it's going to be mixed up with another medicine. That is not good. That is so not good. We don't want mixed medications because if it's a blood pressure medicine, someone is taking antibiotics. It's not fair for somebody to be taking the residue of someone's antibiotics. It's not right. Remember, what you want people to do for you, do the same for them. And then because it's being crushed, you want to know whether the person like it in applesauce or pudding. Mostly if they are with it alert and oriented, they will tell you, I want it in applesauce or I want it in chocolate pudding or vanilla pudding. Make sure you are putting a small amount of that pudding or that applesauce because some residents, when you put too much, they will not eat it. And because you've missed the medicine in, you'll be wasting the medicine if it's too much applesauce or too much pudding. So half of the spoon of that applesauce or that spoonful of the applesauce, you add it so they will take it. And because it is very bitter, when you crush a medicine, you take it from it original form to powder. It becomes very bitter. So make sure that you give them enough. If they want orange juice, give them orange juice. If they want apple, give them apple juice or enough water to flush it down quickly. If not, they will tend to not like to take medication because they know that yuck, you are bringing that nasty thing. They'll be doing all that to you because yeah, it tastes nasty in that crushed form. It tastes nasty, even in that original whole pill. It doesn't take right. It doesn't taste well. So how much more crushing it? So not all medication can be cut or crushed. Do not ever cut or crush pill that has an enteric or hard coating. If it's a capsule, don't crush it. If a pill that says sustain or time release, don't crush it. So enteric coated pill has a protective shell that allows it to pass through the stomach without dissolving. So those enteric coat medicines, it gets dissolved or absorbed inside the small intestines. So if you crush it and it gets into the stomach and is dissolving there, it didn't get to its target. So the effect and the impact it's supposed to do for the body, it may not do it. That's why they have made it in that order. So unless a doctor say crush it, please don't assume anything and crush anything. Capsules absorb over time. So don't go and crash capsule when doctor has not said you should crash because they said, oh, that big old pill, I don't want to take it. Don't do that. Ask permission. Ask from the doctor. Let them change the orders. and they'll be able to change it from capsule to something else. Or if the doctor say, oh, it's okay to open the capsule up and put the powder inside the pudding, then do that. Only on the doctor's order, only on the nurse practitioner's order must you do that. If not, don't do it. Let's look at liquid medications. A common way to administer liquid medications, we see them in the suspension solutions, syrups, elixirs. You need to be aware when giving or measuring these liquids. Always understand. Some of them, it will tell you specifically, shake well. Some of them, it requires you to dilute prior to administering it. So liquids like dilantin suspension, it will tell you shake well. When you have liquid potassium or and bulk laxative, it must be mixed with sufficient fluid to decrease side effect. All the instruction will be on the package. Make sure you are reading it and you follow the instructions on it. So a solution, some of the liquid types, we have the solution, we have the suspension, we have the syrup, we have the elixir syrups. We see all those in the cough syrup and the other ones. Some of them really taste nasty. Some of them really taste nasty. And we have the suspension. Some of the laxative are suspension. You have to shake them well before you can give it. So you look at all those, make sure that you put your medicine cup that has the measuring around it, put it on a flat surface. And then when you pour it, don't pour it from where the bottle label is. Pour it from the opposite side of the label. All the medicine that are in liquid form are in bottles. It has label on it where it says the medicine name, how much to give, and all that. When you are pouring it, pour it from the other side, the tip, the other side where the label is. Because when you are pouring from the label side, what happens is that some of them drips around the tip, and then it begins to distort the label. So it can erase when it is dripping down because we poured it many times. Sometimes it can distort the label, and as time goes on, you can't see what is written on the label. So we are encouraged to pour it from the opposite side of the bottle. It's very important. Obtain, so when you are pouring that liquid, look at it from an eye level. When you put it on the table, we will see it inside the video when we watch. You see how it is being poured. Make sure it is at the eye level. If it's 30 ml, it's at the 30 ml level. Do not mix liquids together. Don't mix a laxative with a cough syrup because they are all liquid medicines. No, don't do that. Never approximate the amount of medication to be administered. It says 0.5. So you are going to make it up to 1 ml. No, don't do that. If it's 0.5, 0.5 is what you get. And you can use, and most of these liquid bottles, it comes with a syringe, a special syringe. Make sure you are using that special syringe. And don't go and use the syrup, cough syrup syringe, and go and use it to squirt out the laxative syrup liquid. Don't do that. Don't do that cross medic. Don't do it. Use what was brought for the syrup. For the syrup, whatever measuring device that came with the laxative, use that one. So use the calibrated syringe for measuring liquids in amount of 5 ml. Make sure it's on flat surface, eye level. Don't use the regular spoons that are inside the kitchen of the facility to pour medication. Say, oh, they said teaspoon, so let me go grab the teaspoon that is in the kitchen. Is not the teaspoon that came with the medicine bottle. Don't do that. Do not do it. So liquids are prepared in separate cups from pills. So you pour your medicine, the tablets in one medicine cup, liquids in another medicine cup, or use the special syringes that came with it to measure. And one thing you must not do, if the medicine came with a dropper, Some of the medicine, it comes with there's a dropper to measure. So you squirt it out. Don't go, and I've seen nurses do that all the time. Do not do it. I can't stress this enough. Do not do this. Okay. They will squirt the medicine inside the dropper, and they will go directly inside the resident room and pour it in their mouth. And then they come and put it back into the medicine cup. That's gross. You don't know. Maybe they have trust, an infection inside their mouth, and you just put it in their mouth, it gets on it, and you go and contaminate the whole medication with an infection. And if that person is healed from that trash, guess what? The medicine has the infection. So that person will never be healed, because every day is a routine medicine she gets. So every day she's getting the same thing inside her mouth. Many people, only God knows what they think when they do all those nasty things when passing medication. All the things they learn from school, they put it away over time and do whatever they please, not thinking about their health and breaking the infection cycle. So please, as we come in the field of medication administration, please, let's not repeat all those things. Do not put that dropper inside the mouth of that resident. Don't do it. And don't cross-contaminate. Go and give it to another person or put it in a different medication. Every special thing that came with that medicine, use it for that medicine alone. So we should be careful. Remember, milligram is not the same as milliliter, ml. So note the difference so we don't create medication or dosing errors. So draw the accurate dose and deliver it to the patient. Do not use the dropper to give the resident the oral medicine, just like I said. That's what this is about. All that I said is what this is about. Okay? So go according to the strength that is being given. Give, if it's ml, give. If it's mg, you give. Let's look at sublingual. Sublingual means it goes under the resident tongue. They are not supposed to chew it. They are not supposed to swallow it. And right after giving it, don't give them water to drink. Let the medicine do its job by dissolving and touching all the nerves that it's supposed to touch. Then after some time, after some minutes, then they can have something to drink. So if there's a sublingual medicine, do that one last. Let him or her swallow all the other medicines, drink water first. Then you tell them, hey, this medicine go under your tongue, so don't drink anything now. So you let them leave their tongue, you put it there and leave it there. Tell him, don't drink anything for the next 5 minutes, let it work. That's how you do that. All right, let's look at oral inhalers. So we have the spacing that goes with oral inhalers. So people that have asthma, COPD, and all those lung respiratory sicknesses or diseases, they may have oral inhalers. Shake or meter those inhalers or the canisters before use, and shake between puffs. So you shake it, you squirt it in their mouth, they will close their mouth and inhale it in. And then you shake it again, and then you do the second one. So the instruction will be in the MAR. Give 2 puffs. 2 puffs. Then you give it. Wait at least 1 minute between the first puff and the second puff. Don't do it. Do one, shake it a minute, then you do the next one. That's how it works. So we look at it in the video, and then when we meet in the lab. Eye drops. Wash your hands before you do eye drops, and then put on your gloves. If it's an ointment, you let them tilt to an angle. You see that in the video. And then you want to pull down the lower lid, and then you go from the corner to the other corner. You want to follow standard precautions whenever you are doing that, and make sure you are not touching the eyeball itself. Be gentle and sensitive when you're doing that. Wait 3 to 5 minutes between medication when different eye drops has to be given. And it will state on the MAR. It will always state on your MAR. Do not touch the eyes with the dropper. It can cause irritation and infection to them. Don't do it. You always want to wipe it when done. So wear your gloves. When it's an adult, gently pulling. When this is the ear one. When you are doing the ear drops, you wash your hands. You put on your gloves. You gently pull the ear, straighten the canal. You put it in. Tell the person to sit in that same position for at least 5 minutes, 5 to 10 minutes, or at least 5 to 10 minutes, so that the medicine can go in. If it's too much of the medicine, you want to give them a cotton to put inside for the excessive leakage. All right, let's look at the nose. For a nasal sprays, you wash your hands, put on gloves, let them lie down a little tilted backwards, and then you squirt it in. Allow 2 minutes for it to reach there. Tell them not to move. Give it a little time for it to get to the nasal tissues. If it's a spray, their head has to be erect. You quickly push it in, and then tell them to sniff it in quickly. When they sniff it in quickly, let them be in that position for a little bit before they can start doing any other thing, so it can penetrate into the nasal cavity. And make sure you wipe the spray with the alcohol prep before you put it back, so that it is not contaminated. So the nasal inhalant too, you do that. Let them sniff it in immediately. When you are doing the transdermal patch, this was the one that I was talking about. Put on your gloves. Wash your hands, put on your gloves before you put it. Make sure you are putting your initial, the date, and the time on it. Put your initial, the date, the time on the patch, so that the next person will know who put it, what time they put it, where it is at. You let them know. You indicate on the mark where you put it last. And then it has to be rotated so it doesn't cause skin irritation to them. Or transdermal patch, whether it's nicotine, whether it's the nitroglycerin, whether it's a pain patch. Don't be putting it on the same place every day. You have to be rotating it, or it will cause them irritation. So always remember, you have to wash your hands, put on your gloves when putting anything topical. Any topical application, whether through the nose, whether it's a vaginal, whether it's rectal, you put on your gloves. You put a new applicator at all times, especially if it's a vaginal thing. If it's the same applicator that must be used, make sure that it's being wiped every time that it's being used. Provide privacy at all times. Whenever you have to put anything, that is, getting into their private areas, you want to make sure that their room is closed or the curtain is pulled. If it's two of them inside that room, the curtain is pulled for privacy. You wouldn't want anybody to do that to you, exposing you to other residents. So make sure you do the same for the resident. When it comes to insulin injection, you want to always make sure this is optional, but you will never know where you have a diabetic patient or resident in your facility. So we're gonna still learn these skills. We're gonna learn these skills. The state allow med aids in the adult care home to give injections. So we will learn how to give it, either in the abdomen or through the arm area. You get something fat to hold on to and push it in there. So we learned that. Don't recap syringes. Dispose of syringes in the sharp containers. Wash hands before and after you wear your gloves. So let's see about ordering, storage, and disposal of medications after you have administered your medication. Where to store, them how to dispose. If you took half out and you want to dispose of, we want to understand how to do all that. So every place that you work, they will orientate you about how to order. Don't wait. When you look at the drug card and you have 7 of the medications left for it to be finished, at the 7th drug, you have to call pharmacy and do the reordering. Or if you are using the computer, your facility will show you how to do reordering through the computer. It is important that you don't wait for the last drug. Don't wait for the last medication before you order, because it takes pharmacy some time for them to prepare these medicines and bring them. The delivery people may have days that they deliver if they are not delivering every day. Nursing homes, we get delivery every night. Every night that I work there, we had delivery. But maybe the small facilities, they may have days, unless it's an urgent medicine. They may have days. So don't wait for the medicine to get to the one single pill or 2 pills. For me, most of the facility that I work, there was a rule in our book that says that when you get to the last 7 drugs, call pharmacy, and then we will call and get it ordered. Know the code, the protocol, the facility code that you have to call and give to them. So always discuss the systems, always discuss with the administrator, know what to do, know where the backup medicines are, where they are stored. So you need to be orientated on all these things to avoid error, because the medicine we were out of stock. Always make sure you are ordering on time. It is very, very important. And know where they are stored and how to properly store it. There are medications that need to be refrigerated. It's a storage of medications. If it says put it in refrigerator, please put it and make sure that the refrigerator is locked. It's only those who are going to pass medicine have access to that key. Store it, because when the state comes around, they look at all those things and make sure that the temperature is accurate, because it's supposed to state in your book what temperature all the refrigerators have to be, the one that has the medicines. Even the ones in the kitchen, the state has a degree that it has to be. Always make sure that you are checking all those things. Lock cabinet, lock your medicine cart at all times, lock the medicine room at all times, and keep the key with you to the end of your shift to hand it over to the next person. You are responsible for everything that is under your care in that 8-hour shift or that 12-hour shift. Always remember that. So store medication requiring refrigeration at 36 degrees to 46 degrees. Controlled substance. Let's talk about controlled substance and how it's stored. Aide must make sure that the number or amount of medicine listed on that controlled substance or the log form is correct before removing any medication for the resident. This is called the count. So we do med count before shift and after shift. Don't let anybody leave the key anywhere and tell you, oh, you were running late, so I left the key here. I already counted the narcotic and every count is right. No, don't accept. Don't accept that. Even though you were late, the person is supposed to wait for you. Or the person is supposed to count with another person, so that when you go, you take the key from that other person. You go and count with that other person. Always count. Don't let anybody count whereby you are not there and you go and accept the key. Because if the count is not right, when you start giving medicine, guess who is going to fall on? It is you. It's going to fall on you. Your license will be at stake. They will call you a drug addict. They will call you that you are an abuser of drugs. Don't you sacrifice your days and time to take this class, and you go and take an exam only for somebody to do a miscount on narcotic for your licenses to be taken from you. I am not doing that for anybody. I don't care how late I am. You will count with me, or I'm not working. I will not take the key. I will not work. I will go home. I would rather be fired than lose my license. And if you take the key, you are responsible. Always remember that. So for each controlled substance, there is a facility system in place to track how much was delivered, how much was on hand when the shift started, how much was used, what was given to the resident, who that resident was, who gave the medication, and how much is left inside. You want to always document why it was given. It is very, very important. I can't stress this enough. So periodically, the controlled substance are counted, usually by two people a shift. It's not usually, it's always counted by two people. Always count with somebody. And med aid may be held responsible. Not maybe, you will be held responsible for a missing narcotic drug on your shift. Controlled substance may be stored in one location in the med card and it has a key. Always keep that key safe. When a Schedule 2 medications are stored in one location together with the other controlled substance, you want to make sure that they are under double lock. So if they don't have a specific key for the narcotic and is stored with the others, make sure all of it are under lock that you have control over, and don't leave it for anybody. No matter what the circumstance, don't leave it for anybody. There must be a readable, retrievable record of controlled substance by documenting the receipt, administration, disposition of that medication. It's very, very important. It's very important. So reasons for disposal of medicines, when we are disposing medicine, maybe the resident refused it after we prepared it. You have to chart why it was refused, why we are disposing it. Maybe the medication was dropped on the floor. So when you count the narcotics and when you pull a narcotic and it fell, it accidentally popped out and you don't know where it fell. Get somebody to witness that you popped and it fell. You can't find it. All of you make attempt to look for it. If you can't find it, the person will have to sign with you the drug that has been wasted and reason, so that they don't count it that you took it and you didn't account for it. Always put it. Maybe the medication expired. That's why we are disposing of it. It has to go back. It expired, it goes back to the pharmacy. Always refer to your facility, what your facility says. So dispose of dosages of medication that have been opened and prepared for administration and not administered for any reason promptly. So if the person didn't take it, you took it out, they didn't take it, it's Adivan, they didn't take it, get somebody to witness with you and put it in the proper disposable receptacle bin. Don't do it yourself and go and write that you disposed it. They would say that you took it. It don't matter who that person, they will say you took it. It is your word against. So if someone is your witness, then you don't have to struggle to explain yourself. So if a medicine was discontinued and expired, it has to be returned to the pharmacy in accordance with the facility policy. Regulations require record be maintained for medicine that were destroyed or returned to pharmacy. When the state comes around, these are one of the big things they look at. From the skilled nursing home to the assisted living to the family care home to all these facilities, narcotic drugs are the medicine book. They go for it and they look at everything, all records. So everything must be followed to the T. Always make sure you are following the specific rules so that you don't put that facility in trouble together with your own licenses. Don't do it. It's not worth it. All right. So at this point, we're going to take 10 minutes break and then we will watch the video. We will take a 10-minute break and we will watch the video. we're gonna start our training video, and I'm just gonna keep letting it go, go, go. And once it's done, every question you have, we will go through all the questions, and we will call it a day for today. And then the last session will be our skills check off. So we're gonna take the test when we meet for the skills. We're gonna take the test first, and then we go over all our skills, and then everybody will do the. So I'm going to email each and every one of you the skills that you're gonna do. So you practice all the skills using the handout that was sent and the videos that you've watched. You're gonna have access to this today's video, so you can go over it over and over and watch the part that you saw that is for the skills that you're gonna do, and then get materials in your home to pretend to be doing that, so that when we meet you know how to perform that skill. All right, so um let's go into the videos. Can you see my screen?
Yes.
Yes, ma'am.
All right, let's go.
Rosalind, there's no
I'm not
sound.
hearing. Oh, yeah. About the same time. We can't hear anything.
You can hear?
No, ma'am.
No, no sound.
Give me 1 second. Right, I'm going to share my screen again. Can you see the video though?
Yes, you see the video, just can't hear what they're saying.
Mm. Can you hear anything?
No,
No, ma'am.
I don't think it's going because the gauge is not moving. So you wouldn't hear anything right now.
It's strange. Give me 1 second.
Take your time. You want to pass the class? We're not going nowhere. I'm trying to. I thought I had a three-total cut, so I could clip this candle in the bottom there. This is my folder. That's what's on my agenda to buy today.
Give me 1 second. Let me try to get it from somewhere else to see.
Well, you take your time.
Let's
I know
see.
I, for one, have nothing else to do but to be here so that on Monday I can pass your class.
Everyone will pass. Let's see. Yes. So here, I'm trying to. I have it on another. Okay, let me share my screen. So I'm going to see if it's going to allow it from now. Okay, so I'm going to share just the media. So let me know if you would. Can you hear?
No,
No?
no, ma'am.
No.
Okay. All right, let's do the entire screen and all right, I will come here. Let me know if you can. Can you see my screen?
We can see it just
Yes.
fine. It's just not no sound.
Okay, what do you see on the screen?
The medication administration.
Okay, now let me play this video then and see if it's gonna.
No,
You
it's
can't
not.
hear anything?
Nothing at
No.
all.
Mm-mm.
All right. Um, that's very strange. um, include here. All right. So sorry for the technical challenges that we having with the sound. I'll figure that part out later. So what I'm going to do is to send everybody that specific video, the link in the email. So watch it. It goes through everything that we have discussed so far. So when we meet for the last session, where the skills, like I said, we will take the exams. It's 50 questions. It go over everything that we've learned, whatever we showed from the handout to the sections document. Everything is inside your student manual. So please make time and go through page by page, cover by cover, and you should be able to pass that exam with ease. So we do that exam first, and I'm going to demonstrate oral medication, how to do it, sublingual. I will demonstrate everything, all the skills first. Then, through the email, whatever I had assigned to you, you are going to demonstrate it for the class, for everybody to see. Each and every one of you have 5 to demonstrate. So you can bring in any materials that you're going to use to pretend to demonstrate that kind of skill for us to see. If not, if you couldn't find anything in your house that you could use, when you come, we can use some of the lab stuff to do that skill, that part of skill that had been assigned to you via the email. And then I'm going to mark everybody off on the form. The state has given us a form. It's the skills competency form. I'll mark everybody off, check everybody off, and then I will send it to the facility where you're going to work, and they will also mark it off, and they will put it inside your employee profile, so that when the state comes around, they will know that, okay, you've gone through the 15-hour class, and so you qualify. So right after the skills day, you are ready to start passing medication immediately. However, the state requires that 60 days after the last day of the competency skills, you should register with them and take the state exams. So the only thing is that you can start passing medication on in the next day. You can start with that certificate that will provide for you. You can start passing medication the next day. The state will have no issue with that. But 60 days after the skills validation, they want you to take the test by the state, and then they will put you on the state registry, so that anybody that pulls you for employment, they will know that you've been approved to do medication with any other facility. So that would be it for today, because the video would have been the last part, but since we are having that technical challenge, we're going to do that via the emails everybody's going to receive. So watch it. And then if you come up with any questions whilst watching the video, when we meet during the skills, bring it up, write it down, bring it up, and I will talk about it. All right, any questions so far with the slides that I have already taught? Did you write anything down that I can answer for you?
No, you was pretty thorough.
Okay,
No,
how about Mama Jamie?
same here.
Any questions?
No, no, ma'am.
Okay. So once you watch the video and you come up with any questions, write it down. Like I said, put in a book, notebook, come with it on the skills day, and let's discuss it. And I believe in all of you, and I know you all going to be amazing medics going forward. I look forward to seeing you on the skills day. So thanks for attending, and see you soon.
Okay. You have a good weekend.